Good morning. It's great to see everyone here. Welcome to Christiana Care's Christiana Hospital. My name is Dr. Janice Nevin. I'm the President and CEO of Christiana Care Health System. I just want to take a moment to recognize and thank the officials who are here with us today. Brian Gordon, the Lieutenant Governor's Deputy Chief of Staff, County Council Member Janet Kilpatrick, Newcastle County Chief Administrative Officer Vanessa Phillips, Newcastle County Acting Public Safety Director Michael Honeke, and I also saw Kathy Jennings, who was with the county and I know was very much part of our original discussions. Thank you also to my colleagues from Christiana Care who are here today. And of course, a very special thank you to Newcastle County Executive Matthew Meyer and Larry Tan, EMS Chief of Newcastle County, for their partnership in the creation of the exciting new program that we're here to announce today. As we all know, the opioid crisis has claimed tens of thousands of lives across the nation, and it continues to ravage families here in our community. The numbers are alarming. Every day, more than 115 Americans die after overdosing on opioids. The number of emergency department overdose visits more than doubled in Newcastle County over the past year. In the emergency department directly behind us, we treated 190 cases of opioid overdose in the 2-month period this past December and January. That's 3 people a day, and there were some days it was many more than that. The cost to society is tremendous. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the U.S. is $78.5 billion a year, including the costs of health care, lost productivity, addiction treatment, and criminal justice involvement. But behind the numbers are the people, our neighbors, whose tragic experiences touch us all. I expect that most of us who are here today know a friend, a colleague, or a family member whose life has been touched by the tragedy of addiction. We know the problem is immense, but we also know that together we can make a difference. To solve this epidemic, we need to work in new ways, together, bringing innovative solutions to this crisis. Particularly innovation through partnership is absolutely critical. No one of us can tackle this epidemic alone. We need each other to achieve success. At Christiana Care, we serve our neighbors by providing the right care at the right time and in the right place to eliminate gaps of care. And every day here at Christiana Care, we have opportunities to reach individuals who are struggling with addiction. With expert care and the tools that medicine provides, we can help them to connect with the support they need and break the cycle of addiction. Our Project Engage program has gained national attention as a model for how to combat the opioid epidemic, connecting with patients at a reachable moment while they're in the hospital. We know this model works. Today, we announce a new partnership with Newcastle County that will enable us to take this proven strategy out into the community. We will provide the same lifeline to those who overdose on opioids, are treated in the emergency department, and then return back to their homes. The Community Substance Overdose Support Program, also called the Community SOS Program, will create a rapid response team to help those in need after an opioid overdose. This unique partnership between Christiana Care and Newcastle County will take the successful model of Project Engage out into the community to reach more individuals and more families with the help and the expertise that they need. This program represents a significant investment by Christiana Care. We are making a $500,000 commitment to fund this one-year pilot, including staffing and expertise from our behavioral health service line, members of our Project Engage team, and our Office of Health Equity. We know that this is the right thing to do, to bring urgently needed help to people in our community. We also know that the opioid epidemic requires a statewide strategy, and we continue to partner with the state in developing a comprehensive approach. I am confident that as this program grows and develops to include other partners throughout the state, we will have the privilege of helping many people in our community break the vicious cycle of addiction and live healthy lives. And I am confident that the model we develop here and what we are able to learn from it will help to inform our approach across the state of Delaware. This innovative partnership will save lives, and it will reduce the financial burden of addiction on our community. Now, it is my great pleasure to introduce an outstanding partner in improving the health of our community. Please welcome Newcastle County Executive Matthew Meyer.
Thank you so much, Dr. Nemec. Can we give Dr. Nemec a round of applause? It's really bold move today. You know, the opiate epidemic is the public health emergency of our time. It is the public health emergency of our time. The numbers keep growing. There were 1,469 administrations of Narcan by first responders just last year in 2017, a dramatic increase from the year before, and already initially in 2018, we're seeing continued increases. Leadership requires that all of us stand up and do something. Shortly after my election, 16 months ago, I spent time going to a number of our paramedic stations around the county. What I found talking to paramedics was that in every paramedic station, they know a few addresses. Where if they get a call from 911 dispatch, as soon as they hear that address, they don't need to hear anything else. They know what the issue is. They know it's an overdose. They know to get their Narcan ready, get on the road, and get out there as quickly as possible to save the individual's lives. You see, in Newcastle County, Chief Tan and the first responders, what they do is they get out as quickly as possible. They save lives. They deliver the patient here to one of the other health facilities in the county, and then they go back to serve again. But they notice that certain addresses, time and again, have the same problems. So Matt Rosen on my team sat down with Kathy Jennings, who worked for us on our team, later with Vanessa Phillips, with Chief Larry Tan of the paramedics, and we started to talk about what we could do. Then we opened it up to the local hospitals, and Christiana took it by the mantle, and they jumped at the opportunity to partner and come up with creative solutions to see if, in addition to the first responders' response, we could come up with a smart follow-up response. Leadership requires that we identify gaps in care. We use the data and information available to us, and we use it to fill those gaps in ways that save lives. We have a tough budget situation in the county. So I went to local hospitals and I said, I want to do something. We have this information. We want to help. We have a lot of people. We have a lot of first responders. We don't have a whole lot of money. Hats off to Christiana Care for stepping up and putting their money where their mouths are. It's going to save lives. We're excited about getting this program off the ground. And we're excited about moving forward in a collaborative way to continue to address this epidemic. Without further ado, I want to turn the microphone over to Erin Booker, the Corporate Director of Behavioral Health here at Christiana Care. Please give her a round of applause.
Hi, everybody. Thank you so much, Matt. What an impassioned speech on an incredibly important topic that at Christiana Care we are so grateful to partner with the county on. I want to start by saying and just reminding that addiction is a brain disease. behavioral defect or a character defect. This is a brain disease. And in the healthcare world, we have tools that can help people. And so we're very excited to have a partnership where we can use the expertise we have to continue to save lives daily. To solve this epidemic, we can't do it alone. And that's been said multiple times, and I'll echo it again. We must partner. As a community, we must come together, and we were so grateful for Newcastle County to reach out their hands and work with us on this. As we move forward, the Community Substance Overdose Support Program is an extension of our comprehensive approach to addiction medicine. We already have in place our opioid pathway, which addresses patients who come in with possible withdrawal, identifies and puts them into care. That partners with our nationally recognized Project Engage team, which does phenomenal work at saving lives every single day. This will be an extension of that as we move out further into the community to reach people at a truly reachable moment after a very low point in their life following an overdose. We know that in the hospital we have a chance to help, but that chance is still out there when they overdose and go home. So our team will go out into the community. It will be partnered with Connections, and we are so grateful to them to help us to provide engagement specialists who are people who have lived experience in recovery and active addiction. That is a critical component to this team, because when you go out into the community and you have been there and you have found your way through, you are a beacon of hope to those who are sick and struggling. So what an amazing opportunity, and we're so grateful to have that community connection to do so. When we're out there, we won't just be talking. We will be reaching out our hand and take you to immediate treatment if you are willing. So this isn't a conversation with no end. This is a conversation that can save lives. We will drive you directly to care if you're willing to take our hands. But we won't stop there. We will also educate families, provide resources. Our staff will be trained in motivational interviewing, which we know is the standard of care to help active addicts to see their path and to see that light at the end of the tunnel. We will also be trained in Narcan. We will provide training to families and help them to understand how to use that in case of emergency. So this isn't just a conversation. This is an action step, and we are so grateful to be able to be a partner with the county. We know the pain that paramedics go through. There is true compassion fatigue associated, and we're so excited to have that partnership to support them, to know that what they are seeing, we will take action on. So without further ado, I'd like to introduce Chief Larry Tan.
Morning. County Executive Meyer, Dr. Nevin, our colleagues. It's a pleasure to be with you this morning to announce the first step, a pilot project, in an effort to find creative solutions to what's been described as the public health crisis of the 21st century. The emergency medical services providers are on the front lines of the opioid overdose epidemic, and the Newcastle County paramedics are no strangers to this battle. In the first quarter of 2017, 72% of all overdose deaths in Delaware occurred in Newcastle County. A majority of the administration of naloxone, or Narcan, that you've heard referred to today, in Delaware is done by emergency medical services personnel. And over 70% of the Narcan administrations took place in a home or residence. The paramedics observe patients as they're revived and they're transported during a 911 response, only to see the same patient again during another overdose event. The individual is seemingly trapped in a cycle of overdose to overdose crises. Our colleagues in law enforcement have already concluded they're not going to arrest their way out of this problem. That conclusion has led to the development of some creative initiatives in Delaware, such as the Hero Help program with the Newcastle County Police and the Angel program with the Dover Police, just as examples. Similarly, the paramedics are not going to be able to Narcan this problem away. Narcan, even as a life-saving medication, only resolves the immediate issue, the failure to breathe that accompanies an opioid overdose. And once the patient survives the overdose, it's imperative that efforts be made to encourage, assist, and even extend a lifeline to that individual to take the next step towards treatment of the underlying issue that set the stage for the entire overdose situation. This is a work in progress. The Community SOS program remains in development, but holds promise from two perspectives. First, as a pathway towards a solution for those struggling with opioid addiction. And second, and this is a very important thing, that multiple components of the healthcare community are willing to roll up their sleeves and collaborate and partner to find creative solutions. And I think it's particularly noteworthy to say that Christiana Cares also reached out to other healthcare institutions to invite their participation in the project as well, and that initiative is certainly worth noting. Our hope is that this initiative represents a starting point that could be nurtured, developed, and eventually expanded to help families grappling with the opioid overdose epidemic throughout Delaware. To Dr. Nevin and the Christiana Care team, I offer thanks for your partnership, your engagement, and your commitment to this project. We look forward to continuing to work with you as we seek creative, multidisciplinary solutions that will positively impact this public health crisis in Newcastle County and the entire state of Delaware. Thank you.
I'd like to thank you all again for joining us. At this time, we will conclude our press conference, but we'll be available for individual interviews if interested. Thank you guys so much.